Hi, everybody. It is the top of the hour. We are going to go ahead and get started. So good afternoon, everyone. Welcome to the Scope at Lunch, a special edition of the Scope podcast. My name is Paige Heitman, and I'm going to be your host for today's webinar. We're going to go ahead and touch on a couple of housekeeping items before we get started. First, this Zoom session will be recorded. We'd like to know who everyone is, so please ensure that your name is accurate. If you need help with this, please reach out to us using the chat box feature. I'll be moderating this session with my Phelps Health marketing colleague, Hillary McCash. So one of us will be sure to help you if you need it. And you can see she's already messaged in the chat box. So if you do have any questions, feel free to just go ahead and throw them in there. Also, we would love to see everyone's faces. It makes for a much more fun and interactive session. If you feel comfortable doing so, please go ahead and turn on your video. Note that each of you are currently muted. If you have a question that pertains to the topic being discussed, please add the question to the chat box and we'll try to get that question answered. You can also add comments in the chat box like Hillary's done. One thing to note about the chat box is that you can send questions and comments to the whole group or to just one person. We'd encourage you to send your question or questions and comments to the whole group so that everyone can participate in the discussion. However, you're welcome to send a private question or comment if you feel more comfortable doing that. We also want to encourage everyone today to utilize the reactions that Zoom offers during this discussion. You can use a hand clap, thumbs up, thumbs down, etc. to let us know if you like, love, agree, or disagree with whatever we're discussing today. Reactions can be found in two places, one either at the top or bottom of your screen, and one you will see when you display the participant list. Also, if you're watching from our Facebook live stream, feel free to ask questions, comment, or show us emoticons during our conversation today. We will be conducting a few polls throughout this Zoom meeting, so you'll get a chance to interact with them if you choose. And of course, remember the chat feature. Some of you today may be using a mobile device, while others of you are using a laptop or maybe a computer. If you find that your features aren't the same or something's missing, we just ask that you participate with us however you can. If you have issues with your sound, the Zoom meeting, or other features, please use the chat box and one of us will, be happy to assist you. So without further ado, I want to go ahead and welcome our guest today, one of my personal favorites, Dr. Cory Offutt, who is a family medicine physician at Phelps Health. Welcome, Dr. Offutt. We're so glad to have you here.
Thanks for having me.
Yeah, no problem. So Dr. Offutt, before we dive in, let's go ahead and just talk about what you do at Phelps Health.
So I am over at the Bond Clinic, which is the Blue Slate Clinic, and I do pretty much full scope family practice with the exception of obstetrics. And I see anything from newborns up to elderly for all types of ailments, chronic conditions, preventative medicine, dermatology, sports medicine. I mean, you name it, I pretty much see everything.
Great, awesome, good to know. So today we're just going to dive right in with a polling question. Hillary, if you can go ahead and populate that. And it looks like our poll is in progress. We apologize. We've been having just a few technical difficulties. We appreciate your patience.
And while we're waiting on that, if anybody has any other questions or anything.
Great, awesome. All right. So Hillary, it looks like you're already sharing those results for those polling questions. So it's actually true. Heredity does play a major role in melanoma. About 1 in every 10 patients is actually diagnosed with the disease or has a family member with a history of melanoma. So knowing that, we're going to go ahead and dive right into our topic today, which, based off of this question is going to be skin cancer, right?
Yes.
So question number 1, Dr. Offutt, what causes skin cancer? Let's just start there.
So as you alluded to, some of it can be genetic and hereditary, particularly with melanomas. Like you said, about 1 in 10 people that are diagnosed with melanoma actually have a family member that has had melanoma or have had a history of melanoma themselves. Skin cancers in general are caused by some type of damage to the cells in the skin. So that can be any number of things, but particularly it's the ultraviolet rays from sunlight and increased sun exposure without using any kind of sunscreen or other protective measures to protect yourself from getting sunburned and excessive exposure.
So that kind of leads me into our next question. Who is most at risk for skin cancer?
So everybody's at risk for skin cancer. It just depends on how much exposure you end up having and what risk or what preventative measures you do to protect yourself from it. So those that are working outside more, have continuous exposure, prolonged exposures to sun, that get recurrent sunburns, that aren't wearing sunscreen of any kind, and then people that are more fair skinned, particularly like redheads that are more fair skinned, are higher risk of skin cancers.
Great. So a question that just came through that I think is worth asking right now is, does eye color play a factor in whether or not somebody is more susceptible to skin cancer? So somebody that has blue eyes versus maybe somebody that might have brown eyes.
So not generally, but the blue-eyed people are generally more fair-skinned. Those are going to be like most redheads have blue eyes kind of thing. And so I think there's some misnomer on that when some people think that it's the eye color, but it's actually just the actual skin pigmentation that they're higher risk.
Great, thank you. So kind of just moving along, what are the most common forms of skin cancer?
So the three major ones are basal cell cancers, squamous cell cancers, and then melanoma. Basal cell cancers are generally more common and do not cause any systemic spread the large majority of the time, so they don't spread as much. They're usually more locally invasive. Your squamous cell cancers do spread fairly often unless they're caught early and removed. And then the melanomas are your most aggressive kind.
So moving on to question 5, you said that melanoma was some of the most aggressive kind. Let's talk about some of the signs and symptoms of those different types of skin cancer that you just talked about.
So skin cancers in general, again, it depends on the type. So going with melanoma, generally those are flat and then they're very, very dark in color. We'll have different shades of black, brown, purples, have very irregular edges, and are usually changing very rapidly to where you can actually notice the changes over a couple of weeks to months, to where if it is actively changing, it really needs to be addressed. And then like squamous cell cancers and basal cell cancers generally will cause either they'll be ulcerated, meaning that they will look like just a normal sore, like if you would have hit your knuckle on a edge of a table or something like that and it peeled the skin back, it looks like an ulceration that's not healing. Or spots that become very itchy that you will scratch off and they'll like go away and come back, or they'll bleed regularly, things like that that are actively changing. Can all be signs of skin cancers that are forming.
So we had a great question come through while you were kind of explaining this. What are things to look for when concerned about a spot on the skin?
And that's where it's called the ABCDE method. So that's going to be whether the lesion is asymmetrical, so it's not perfectly round like a normal mole is. They have very irregular borders. So instead of a nice round smooth border, it might have like little jagged edges. Different color variations like we had talked about a second ago. And then if they're larger than like a pencil eraser in diameter and are actively growing, that's always a concern as well. And then the evolution is the E, and so how it's changing as well.
Great, thank you so much. So question number 5, what are some of the risk factors for the different types of skin cancer that we've been talking about?
And this actually feeds into a question that just came through the chat as well. Are tanning beds worse or better than sunlight? And the answer is tanning beds are far worse because it is actually direct exposure directed just towards you, towards the skin, in a higher intensity than what sunlight would be. And people that are generally in tanning beds aren't wearing sunscreen the large majority of the time either. And so tanning beds actually increase your risk significantly. And then spending excessive amounts of time outside without sunscreen of any kind, people think just because you have a tan means that you don't have to wear sunblock anymore, and that's entirely not true.
Yeah, so another question that I'm thinking of, something that just pertains to me is I tan fairly easily. I'm not very fair skinned. Mm-hmm. So would I need to wear a higher SPF, a lower SPF based on whatever type of skin tone I have?
Generally, it's the higher the SPF, the better, because the higher the SPF, the more of the UV rays that it's actually blocking out. So I usually tell patients if they have a history of skin cancer, get as high of SPF as you can get, particularly on the face and the more directly exposed areas like the tops of your shoulders and your arms, and like tops of your back and the back of your neck. Tops of your ears are super commonplace that people forget about. And so I tell people use like SPF 100 on those, which is harder to find around the stores and everything, but you can get it online. And then at least 50 or higher for everywhere else.
Great advice. Thanks. So question number 6, can skin cancer spread and how quickly does it spread?
Depends on the type. And so, like I said, basal cell cancers are locally invasive. They don't generally spread to other parts of the body. They can, but generally they don't. Squamous cell cancers do spread to other parts of the body, and melanomas spread very, very quickly and aggressively.
So kind of just jumping right along to question number 7, can skin cancer be inherited?
So yes, there are specific conditions that increase your risk of skin cancers. I won't go into the nitty-gritty genetics or anything like that, but there are several inherited conditions, particularly with melanomas and squamous cell cancers.
Should somebody, if they have a family history of skin cancer, should they start screenings earlier in life? Should everybody be doing screenings regardless of whether there's a history?
They should be getting screenings at their yearly wellness exams if they're going in for yearly wellness exams, particularly if you have a family history of any kind of skin cancers, then I recommend at least once a year having skin exams done from head to toe.
Great. And what does a skin exam look like? Is that very invasive?
So invasive, not depends on your definition of invasive. Your definition and my definition are probably two different things. You do have to be completely unclothed because skin cancers don't care what part of the body they're going to be showing up in. I've had patients have skin cancer, like have a melanoma inside their belly button that they would have never even seen. I've seen skin cancers on the inside of the private areas of females as well. Like it's all different for different people. And so you really have to do a head to toe exam to make sure, because there's parts of your body that you can't see directly yourself. And so you need to have somebody that knows what they're looking for, being able to take a look.
Yeah, absolutely. Great advice. So we had a couple of questions come through that I want to take a second and just kind of talk about. So the first one was from Christine, really great question. If a cousin has a family history of melanoma, would she be more at risk, or would it be more of like if a parent or sibling had melanoma?
Usually it's a direct family member. So I usually say if it's a grandparent, parent, or sibling, then you need to start screening well in advance of the time that they were diagnosed. And there's not a specific time for skin cancer screenings. Basically, the earlier, the better.
Great, awesome. And one more quick question from Janessa. Can skin exams be done with our primary doctor, or do we need to see a dermatologist?
They can very much be seen by your primary doctor. And then some primary doctors are very comfortable with addressing any abnormal skin lesions themselves, like myself. But then if there's anything abnormal that they're not comfortable with, they can always refer to a dermatologist at that point, which it's a lot easier to get into a dermatologist if you have a referral from your primary provider.
Perfect, awesome. So moving along to question 8, how can someone tell if their skin cancer is melanoma without going into like a primary doctor or something?
So without actually having a biopsy or anything like that, it's really not possible to tell if it's definitively melanoma or any skin cancer for that matter. But things to, like I said, to watch out for: the very irregular borders, it's rapidly growing, the different color variations, whether it's asymmetrical, are all very concerning features.
Yeah, so really just noticing if there's anything different with your skin, anything other
Absolutely.
than what's normal, right?
And when in doubt, always ask. Like I have all of my patients, they know that they can even send me pictures of different skin lesions and moles and stuff like that on my chart and ask me if it's something that they should be concerned about or need to be seen for. That way they don't necessarily have to come into the office for every little thing that they find on their skin.
So for skin cancer or melanomas, things like that, is that something that you could even do through a telehealth visit?
Some of them, yes. Some of them we really need to see and feel, like if they're raised and things like that. And a lot of the times, if there's something concerning enough, that I'll actually just address it that day and do a biopsy or an excision that day whenever I see them. There's another question on, are sunspots more susceptible to skin cancer? And that's actually no, but you're more susceptible to skin cancer if you have more sunspots because you're exposed to sunlight more. And so the sunspots themselves aren't necessarily going to turn into cancer, but you have higher susceptibility to it because you're being exposed to sunlight more.
Great, thanks so much. So question 9, I know you kind of answered this, but let's just touch on it again. What's the relationship between sunburns, tanning, and skin cancer?
So the more times you're sunburned, the higher the likelihood of skin cancers because that's damage to the skin. And tanning is like the more you go tanning purposefully without sunblock and things like that, the more direct exposure you're getting as well. And so the higher likelihood you are of developing skin cancer.
What about scars? If somebody has like ACL surgery and they've got like a scar on their leg, is that spot more susceptible to skin cancer?
No, it is actually not.
Great, awesome. Great myth to debunk, right? So then question number 10, you had also mentioned this earlier, but
Yep.
again, let's just touch base on it for everybody. What is the ABCDE method and why is it so important?
So that's basically what to look for in regard to if it should be concerning skin lesion or not. So that's whether it's asymmetrical or not, if it has abnormal or smooth borders. So if the borders are very jagged and not really smooth and rounded, which there are some skin cancers, again, exceptions to that rule that can be smooth and rounded as well. Like basal cell cancers can definitely be perfectly round, but they are growing vertically instead of outward. And then the color, like the coloration of them, whether they have different shades of black, brown, blues, purples, things like that, how big they are or the diameter, and then how they're evolving or changing.
Perfect, awesome. And it looks like Hillary also put this information in the chat for anybody that wants to copy, paste it, print it out for future reference or knowledge sharing, anything like that. So moving along to question 11, what does a self-examination for skin cancer look like?
So basically, starting every single place that you are able to see on your own, taking a look to make sure, is there any abnormal skin lesions, anything that you are concerned about. I always encourage people to take a picture of it and then go back to that a couple weeks later to see if it looks the same. And so keeping like a different folder, like if you're using your phone for pictures, keeping a different folder on your phone just for, and making sure you label each of the skin lesions on the pictures and everything, so you can actually know if it's changing or not. Making sure that you use like a small tape measure or something like that up next to it so you can see if it's changing in size. And then just basically looking every single place that you're able to. And then if you have like a significant other or somebody else in the house that can look at the places that you're not able to directly look at to see if they can find anything concerning also.
Great, awesome advice. Question number 12. What should someone do if they spot any warning signs of skin cancer?
Talk to their primary care provider as soon as possible because the sooner you get it biopsied or figured out if it's cancer or not, the sooner you can get treatment. Sometimes just doing the biopsy, which is called an excisional biopsy, where I remove the entire thing all at once and then send it to the pathologist, is treatment enough.
What if somebody doesn't have a primary care provider and they notice that, maybe they have some warning signs of skin cancer? Can they still make an appointment to see a PCP?
Absolutely. And so if they have something that's super, super concerning, I don't know how other primary care providers do their clinics, but if it's something patient calls in and says, hey, I've got I think I have a skin lesion that might be cancer, I will usually go out of my way to make sure that they get in sooner rather than later and not make them wait weeks upon weeks to get in. They are also able to just call the dermatology office in some instances and see a dermatologist without a referral as well.
Great, awesome. But again, back to your note, this is why it's always really important to have a primary care provider.
Absolutely.
Right? So we're going to go ahead and move on to our next polling question. Hillary is going to launch that for about 10 seconds. And Hillary is sharing the results right now. And Hillary or Dr. Offutt, if you guys just kind of want to share the results of those polls.
So do you know someone who has skin cancer? 93% of people said that they did. 7% of people said they did not. And that could just be that people don't share that they had skin cancer because it's actually fairly common. It's more common than you would think.
Yeah, how common is skin cancer, Dr. Offutt?
So I see at least several patients a day for evaluation of skin lesions. And I would say usually I have several a week that end up being positive for skin cancers. I see multiple patients per day with precancerous lesions.
Wow. And so what are some, actually, we'll just go into our next polling question. What are some treatments for skin cancer, or even people that, you find precancerous things on their skin?
So it's always better to treat it if it's precancer, because then you can prevent them from turning into cancer. And usually that's just either doing like what's called a shave excision, which we numb you up and we use basically like a razor blade to shave it off at the surface of the skin, or we freeze them in the office. And that's the large majority of them, is that I just freeze them here in the office. And then depending on the type of cancer and where it's at would kind of dictate further treatment and how large it is, whether it's deeper growing or more horizontally growing, whether it's basal cell, squamous cell, or melanoma, would dictate the treatment.
And it looks like we had another question come through from Tanya. How can you tell the difference between an age spot and possible cancer?
So again, that goes back to your ABCDEs. Age spots. There's lots of different types of spots that people term age spots. There's what are called lentigines, which are like your sunspots and things like that are really, really flat. They are usually one shade of brown. They can sometimes have some irregular edges on them, but then they're not changing in size and things like that. There's another type of spot that people attribute with age spots called a seborrheic keratosis, which are slightly raised, but they kind of have like a waxy feel to them, and can be somewhat scaly at times. And those are the ones that pop up on people's faces, on their temples, things like that, that aren't anything to be concerned about. They're not going to turn into any cancers. But again, like if you're unsure, always ask your primary care provider.
Great, awesome. So kind of just moving right along, what surgical procedures may be used to treat skin cancer?
So, and this goes back to, again, it depends on the type of skin cancer. Melanomas, you're going to have a much wider excision because they tend to be more invasive. And so you want to make sure you're getting all of it out. And then basal cell cancers, again, usually that's just an excision and you're done. Squamous cell cancers, usually an excision. And then depending on if you have clean borders, meaning that you got the whole thing out or not, or if it shows that it's invading the local blood vessels or nerves, then we would end up sending you to a hematologist or an oncologist rather, and getting further evaluation for potential treatments of either chemotherapy, radiations, and the same is true for melanomas.
Great, thanks so much. Question number 15, what side effects can someone see during treatment for skin cancer or melanoma?
Depends on the extent of the treatment needed. Here in the clinic, if we're just doing excisions or cryotherapy or the freezing of the precancerous lesions, the freezing burns some, and then you can get a blister and stuff from that. That takes about a week to 10 days to heal. The excision, the numbing medicine hurts. You don't feel anything after that. Have to come back in about a week to 10 days to have sutures removed. It'll feel bruised for a few days. But other than that, just your side effects of chemo and radiation if the cancer is pretty extensive.
Perfect. So question number 16, you kind of alluded to this. And again, we know that this depends on the level and the type of cancer that somebody may have. But what types of doctors might someone see during treatment for skin cancer?
So primary care provider first, and then either dermatology or oncology would be your primary treatment. Sometimes a general surgeon, depending on the location of the lesion and the extent of the lesion. So sometimes, if you have, say, a larger melanoma on your trunk that needs to be completely excised in the OR, then you would see a general surgeon first, and then see oncology as well.
After somebody's completed cancer treatments, let's say that they go throughout that process, do they go back to their primary care provider after they're done with treatments?
Absolutely, and they should be still seeing their primary care provider during treatments as well. If you've been diagnosed with cancer, generally you're going to have much more frequent skin exams than yearly. Melanomas, I generally say every 3 to 6 months at least. Ideally every 3 initially, and then every 6 after that, after like the first 1 to 2 years after you've already had melanoma.
Mm-hmm. Great, awesome. Question number 17, why should someone who has skin cancer consider clinical trials?
Because there's always new and developing treatments, and there's always some resistance, like cancers across the board, not even just skin cancers, can become resistant to certain chemotherapies and treatments. And so we're always looking for new ways to treat and cure cancers. This is actually really relevant recent one, like with the COVID vaccines, they are actually looking into potentially using them for cancer treatments, or the type of vaccines. So the mRNA vaccines can actually potentially be used by changing the receptor that they have the mRNA for, using a receptor from a cancer cell, and then making your body actually kill its own cancer.
Wow, that's amazing. So what is it in mRNA vaccines that makes it applicable to like cancer trials?
So mRNA is the sequence of amino acids that will basically, it's instructions for your body to make a protein of some kind. In the instance of the COVID vaccines, the mRNA is coding for the COVID spike protein. And then your body actually makes the COVID spike protein, which then is recognized as abnormal and makes antibodies against it. So they could do the same, in theory, take the receptor from a skin cancer or melanoma cell, take a receptor that's only found on that cancer, and figure out the genetic sequence and make the mRNA for that, and then use that in the vaccine instead, and your body could potentially attack the cancer cells.
Very cool. That's awesome. So we had a question come through while we were talking about this. My primary is a family nurse practitioner. Are they fully educated to perform a skin screening?
Skin screening, yes. And then every nurse practitioner or physician's assistant should be able to recognize any abnormal skin lesions. I actually have 2 physician's assistants and 1 nurse practitioner under me, and they're frequently screening their patients and sending them my way for biopsies and excisions and things like that. So they should be able to screen for them, yes. They may not be able to do biopsies and stuff like that, depending on their comfort level and training, but they should very easily be able to recognize something that's abnormal.
Great. Thanks so much, Dr. Offutt. So moving along to question number 18, what is the chance of the recurrence of skin cancer once someone is in recovery?
Depends on the type of cancer, and depends on how well they are doing their preventative measures. So are they wearing sunblock now? Are they still going to a tanning bed? Are they still laying out in the sun and tanning excessively? Things like that. And so it's very much dependent on that patient and the type of cancer that they had.
Great. Question number 19, and this is a really interesting question, I think. Are rash guards enough to protect someone from the sun, or should sunscreen still be applied underneath? What should people look for when purchasing sun protective clothing and gear?
So basically, all sun protective clothing that's marketed as sun protective clothing should have the amount of ultraviolet rays that it is filtering out. And so the higher amount of ultraviolet rays that it's filtering out, the better. Same with sunblock. Sunblock should always be used as well, in addition to any sun protective clothing. And then ultimately, higher SPF again, the better. And then decreasing the amount of time that you're directly exposed as much as possible. I mean, we should get some direct exposure because we still need that vitamin D level and things like that to go up, but it's all in moderation.
Great, awesome. Question number 20. Is it really necessary to wear sunscreen on a cloudy day?
It is. The ultraviolet rays still come through. Just because you're not feeling the sun's effects does not mean that the sun or that the clouds are filtering out the ultraviolet rays. So some of the worst sunburns I've ever seen have been on cloudy days.
Yeah, let's debunk a myth for a second. So I have often heard, and I'm from a rural area, so take this with a grain of salt, that you get a worse sunburn or that you can get more tan on cloudy days. Is that true?
It's not true. It's usually because the reason people think that is because you're not getting as hot, so you're staying out longer. Mm-hmm. And so generally you'll get more tan or worse sunburn because you're staying out a longer period of time because it's not as hot. So yeah, you're totally it's right. Not because of the cloudy day, it's because you're actually just exposing yourself longer periods of time. Mm-hmm.
Great. Question number 21. What's the best way to treat a sunburn?
So just making sure that you like aloe and making sure it stays hydrated, things like that. But really just don't pop the blisters, leave the blisters intact as long as you possibly can. Don't peel it as long as you can. If those blisters do pop, don't peel that skin off. It helps protect it and keep it from getting infected. Perfect. And then just keeping it cool as much as you possibly can. There's really not a way to speed up the process.
Mm-hmm. Yeah, it'll happen at its own pace. All right. Question number 23. How can we reduce the risk of getting skin cancer?
So, I mean, I feel like I'm beating a dead horse with the sunblock and everything else, like sunblock, and as much sun protection as you can possibly do. And then just avoiding those things that we know and have been proven to cause skin cancer. So tanning beds and everything are the worst thing you could possibly do. Purposely going out and laying in the sun, I know it's very relaxing and everything else, but if you're doing it without sunblock, you are doing more harm than good.
What if somebody wants to use like coconut oil instead of sunscreen? What would you say to that person?
Absolutely not. So that is basically just speeding up the process of damage.
Yeah, great advice. So it looks like we have one more participant question before we wrap up today.
Yep.
Is there a recommended amount of time to have daily sun exposure?
It depends on it's not even a specific amount of time that you should get. You don't want prolonged excessive exposure. So like small increments, like 5 minutes here, 10 minutes there, 15 minutes there, rather than 3 hours straight is going to create less damage because you're not allowing your skin temperature to get up higher to where it's doing damage to the genetics of the cells to where they can then have to be repaired or become abnormal to end up causing a cancer.
So long story short, it kind of depends, right?
So when in doubt, the less exposure, the better.
Great.
Or less frequent exposure, the better.
Well, it looks like that's kind of it for our participant questions. We answered a lot of them as we went through this today. So now we're just going to kind of wrap up. Thanks so much to everyone for tuning in to the Scope at Lunch. We always appreciate everybody tuning in for these. A huge thank you to Dr. Cory Offutt for joining us today. We appreciate all of the insight that you've been able to share with everyone. As a reminder, this show has been recorded and will be emailed to participants. It can also be rewatched on our Facebook page and shared with family and friends who may have missed the show. If you liked this show and would like to know more, check out our other episodes of The Scope on YouTube or visit phelpshealth.org. Have a great rest of your day, everyone. Thanks so much.
Thanks for having me.